welcome to this presentation where I will be discussing the link between vitamin D levels and the onset of diabetes. So what is diabetes? Well, it is a chronic condition. You can either have type 1 diabetes, which is an autoimmune condition, or you can have type 2, which is a metabolic syndrome. So how is vitamin D linked to the severity of diabetes? Well, diabetes in the world's population is ever increasing, and the main reason for this is a rise in obesity levels. But to try and tackle the rates of diabetes, obesity is the main factor to address. However, this is easier said than done due to the modern lifestyle, which seems to be fueling the obesity epidemic. So scientists are looking for other options to address the diabetes increase. One of these options is vitamin D. So the sun is our primary source of vitamin D. However, you can get a small amount of vitamin D from foods. However, this is less than 20%. And these food sources of vitamin D include oily fish, which includes salmon, sardines, herring and mackerel. Any sort of red meats, that's pork, lamb, beef, liver, egg yolks, fortified foods, and well, you can get vitamin D from dietary supplements, which is what I will go on to in a little bit. Cow's milk in the UK is not fortified, so it wouldn't be considered a good source of vitamin D. However, in other European countries, it is fortified, so it would be included in the foods, which would be a good source of vitamin D. So the link between vitamin D and diabetes, well, the epidemiology of vitamin D is inversely proportional to that of diabetes. So blood levels of 25-hydroxyvitamin D is the main indicator in the blood of vitamin D levels. So this will decline with age, and it is also lower in those that are obese and those with ethnic backgrounds, so Hispanic, Black and Southeast Asian origin. Diabetes rates increase with age, so like I said before, they are inversely proportional. And what I'm going to go on to now is just a couple of studies which show the link between diabetes and low vitamin D levels. So there's a study by Farahi et al, and this was in a small cohort town in England called Ely, and what they did, they had a sample group and they tested their vitamin D levels, and then went back to the same cohort of patients 10 years later and discovered that if the patients had a lower vitamin D level to start with, they were more likely to develop type 2 diabetes later in life, and therefore low vitamin D levels would show that there's an increased risk of developing type 2 diabetes. Another study that just supports the findings by Farahi et al is a Finnish study, and they demonstrated an inverse relationship between baseline serum, 25-hydroxyvitamin D, and a 17-year risk of developing type 2 diabetes. So both studies have strong evidence that low vitamin D levels to start with may increase your chance of developing type 2 diabetes and will preempt hyperglycemia later on in life. So that's just higher blood glucose levels. So just to conclude, as well as preempting hyperglycemia, there is prospective evidence that low vitamin D levels can result in hyperinsulinemia. So this means where your body's insulin doesn't work properly and therefore causes type 2 diabetes. It also shows that sufficient levels of vitamin D may act as a preventative to developing type 2 diabetes. So this shows that proper supplementation of vitamin D can decrease the risk of developing diabetes later in life. So what should my vitamin D levels be? Well, an average person's vitamin D levels should be in the optimal range of about 25 to 80 nanograms per milliliter. Anything below this would be considered insufficient reading. And it is suggested to raise the amount of vitamin D in your body to around 60 to 80 nanograms per milliliter would be sufficient to stop the onset of type 2 diabetes, and it will help regulate those blood glucose levels in patients who already have developed type 2 diabetes or those that have diabetes in the family. So to test at home, we have a vitamin D home testing kit. So your personalised vitamins rapid home self-testing will give you quantitative determination of your blood capillary levels of 25-hydroxyvitamin D. So what you'll get is a result within 20 minutes, which is super fast, a personalised 6-month supplement program, which will help you optimise your vitamin D level if you do have a insufficient reading. Your personalised vitamin D supplement plan will be delivered directly to your door. And then 6 months later, you can retest your vitamin D level to see if you've maintained those optimal levels. We also have a trained team to help you discuss any vitamin D related questions that you might have. So these are just the references to the studies that I did in the slide. And from all the staff at Your Personalised Vitamins, thank you. And if you want any more information, please visit www.yourpersonalisedvitamins.co.uk for any further information.